All right, so welcome everyone. I think we can get started now. So thank you for joining us for the webinar 1 year after Dobbs. A few housekeeping items before we begin. We would greatly appreciate it if you could keep yourself on mute unless you're asking a question, and this will cut down on background noise. Speaking of questions, while we do have time allotted at the end, please don't hesitate to ask during the presentation. You can use the chat. We have the Q&A feature turned on, or you can unmute yourself temporarily. And finally, this webinar is being recorded, although when we get to the question and discussion portion, we will stop the recording so that folks can speak freely. My name is Samantha Berg, and I am the manager of state advocacy for the Society for Maternal-Fetal Medicine. I know we have a handful of folks joining who are not SMFM members. So for those who don't know, we are a nonprofit association with more than 6,000 members, our core membership being maternal-fetal medicine subspecialists. We are dedicated to advancing optimal and equitable perinatal outcomes for all who desire or experience pregnancy. And our work falls under 3 overlapping categories: advocacy and partnerships, member engagement and support, and knowledge, education, and research. Under our advocacy and partnerships bucket of work lives our state liaison network. This is a member-led program that focuses on state-level advocacy and the implementation of state-based public health programs. We aim to harness the power of clinician leaders in each state to provide intelligence and serve as SMFM's ambassadors and advocates. We have worked with our SLN members on a number of advocacy activities, including drafting legislative testimonies, submitting reports and letters of support, and more. So with that, I'll move on to today's webinar topic. And so we are going to use this time to first reflect on the past year since the overturning of Roe v. Wade, diving into changes in policy, institutional responses, and more. And then we are going to look ahead at what is to come, talk about how to keep up our momentum, and then we will have time at the end for questions and a discussion. And again, we'll stop the recording for the discussion. So in a moment, I'm going to hand it over to Dr. Chloe Zara, our Vice Chair of our Health Policy and Advocacy Committee, to walk us through the changing policy landscape. But I'd first like to ask everyone a quick question. So if you could take out your phone to use the QR code, or I believe someone will pop that link in the chat. We'd love to see how you all have been impacted by the Dobbs decision. And I'll give folks a few minutes to respond. So it looks like folks joining us today are severely or in a way very impacted by the Dobbs decision. And so we'll have more opportunities to share your experiences and talk about what you've been dealing with throughout the presentation. Awesome. With that, I will turn it over to Dr. Chloe Zara.
Hi, everybody. I'm Chloe Zara. I'm the Chief of MFM at Beth Israel Deaconess Medical Center in Boston. And as Samantha mentioned, also the Vice Chair of the Health Policy and Advocacy Committee for SMFM. Really happy to be joining everybody today, although I wish it wasn't to commemorate Dobbs. Because as we know, it's been just over a year since the Supreme Court case that overturned Roe versus Wade. We also know there was already inequitable and inadequate access to abortion. Nonetheless, the impact of the Dobbs decision across the country really has been immediate and profound. And every day, I think many of us are dealing with the aftermath. Some of us live and practice in restrictive states where we have to turn patients away or tell them we can't treat them until they get sicker. Some of us are in protective states, many of which are now being flooded with patients traveling hundreds of miles for care. Next slide. So to bring us back to the days leading up to Dobbs, a reminder that abortion may have been legal in theory, but in many places it wasn't accessible. This is a map from Abortion Finder that shows the range of gestational age limits by state as of June 22nd, a couple days before the decision in 2022. You can see some states did not have any access at all. And this is really what abortion providers looked like. So this large parts of the country had very few abortion providers. If you look at the next slide, reinforcing what we know, that legal does not necessarily equal accessible. The lack of access to care prior to Dobbs was really the result of a long, coordinated, targeted attack on abortion care. And under Roe, anti-abortion organizations and politicians had been chipping away at access over years, leaving many states, huge swaths of the country, and patients without care. Specifically, over the last few decades, states have seen hundreds of bills known as trap laws or targeted regulation of abortion providers. These laws are aimed at shutting down abortion clinics and make the process of getting abortion care much more burdensome for patients. Examples of these kinds of laws are things like requiring hallways to be at least 6 feet wide, imposing waiting periods on the decision, having an ultrasound or a counseling requirement. And these laws really result in delaying abortion care, deferring abortion care, and folks having to travel for abortion care. Next slide. After the Dobbs decision, there were total bans enacted in 9 states through trigger laws. So these were existing laws that had been passed and went into effect sort of the second Roe was overturned. In 4 other states, the trigger laws led to severe restrictions, some of which based care limits on fetal heartbeats, which, as we well know, is well before many patients know they're pregnant. This means that the few providers in the states that were affected, not the few providers, the many providers in the states affected, could no longer provide the care that we are trained to provide. Next slide. Meanwhile, in the last year, it would be an understatement to say that a lot has happened. The landscape's really been continuously in flux, which leads to confusion. Even those of us that keep really up on this, it's very confusing to know what is legal, who can be criminalized, where patients can go. In 2023 alone, there were over 700 bills impacting abortion that have been introduced in state legislatures. And currently, abortion is banned or unavailable in 14 states. It is severely restricted in several others. So most of these abortion bans are enforced through criminal penalties and jail time for providers, but some also include bounty hunter statutes, which are modeled after the Texas SB 8 law, which is the infamous bill that went into effect in September of 2021, allowing private citizens to report providers and each other for quote unquote illegal abortions. So with large chunks of the country hostile to full spectrum reproductive health care, many providers are unsure of whether to stay or relocate. And additionally, patients are being forced to travel hundreds of miles to delay their care more than ever before. Unfortunately, many of them are ultimately not able to get the care they need. Even in protective states like my own, viability bans still force some of our patients to travel to the few places where abortion is fully accessible. And most abortion bans have focused on gestational age limits, but we're also seeing targeted attacks on medication abortion specifically. Examples are Arkansas, Florida, Montana, Wyoming, all of which have passed laws that restrict use or access to medication abortion in some way. Next slide. These attacks on abortion care are not happening without a fight. So this is a map from Kaiser Family Foundation that shows the status of abortion litigation in state courts. And as you can see, there are several cases that are still ongoing that, and those decisions could really have rippling effects. One example, Florida is still waiting to hear on the constitutionality of their 15-week ban. But since that ban was passed, a 6-week ban has been signed into law by Governor Ron DeSantis. So a lot is really still up in the air. This map doesn't include the individual suits that have been filed in states by both patients and providers, including in Texas and in Idaho, folks who are bravely stepping into the public eye to call out the injustices they have faced. Next slide. We're also battling in federal courts, most notably over access to mifepristone. In arguably the most notable case impacting MIFI, which is the Alliance for Hippocratic Medicine versus the US Food and Drug Administration, anti-abortion advocates have been challenging the FDA's authority in the approval of mifepristone. I'm sure all of you recall the confusion from a few months ago as the case made its way to the Supreme Court, where ultimately it was decided to maintain the status quo while the request for injunction is heard on its merits. Of course, we've seen several other cases that impact mifepristone filed during this chaos. One was filed by the generic pill manufacturer, GenBioPro, and another was filed by a collective of attorney generals and protective states, which was exactly the opposite ruling by that federal judge. So in addition to the battle over MFE, we have seen the Emergency Medical Treatment and Labor Act, or EMTALA, used in federal suits to protect our ability to provide life-saving abortion care, notably, again, in Texas and in Idaho. Next slide. So along with the courts, there's also been a fight at the ballot box. In 2022, there were 6 ballot measures that impacted abortion access. As you can see in this graphic, abortion access wins. It prevailed in all 6, with 3 states enshrining abortion access in their state constitutions. 2 states fought off amendments declaring that there is no constitutional right to abortion, and 1 state fought off a born alive, quote unquote, constitutional amendment. So with the widespread success of these ballot campaigns, we can expect more to come this year and next. Fortunately, this means we can expect more attempts from the anti-abortion groups as well to make these processes more difficult. For example, in Ohio, there's an effort to increase the threshold for ballot measures from 50% to 60%. So the vote for that is being held in a special election this August, which means that if it passes, Ohio's potential ballot on abortion that is scheduled for November will require at least 60% of total of at least 50%. Next slide. So in addition to battling bans in the courts and with ballot measures, many states are using legislation to shore up protections. So as of June 16th, 20 states and DC have enacted shield laws that protect providers, out-of-state patients, or both from out-of-state investigations. In fact, 10 states and DC have enacted a total of 15 shield laws in 2023 alone. Several states have enacted other laws to expand and protect access to abortion. For example, Colorado enacted a law to mitigate the impact of anti-abortion crisis pregnancy centers by banning deceptive advertising. New York now requires all public colleges, community colleges, and university campuses to provide medication abortion. Rhode Island passed a law allowing public funds to cover abortion, including for state employees. And Washington enacted the My Health, My Data Act to regulate companies that collect and share health-related data. So now I'm going to turn it over to Alicia Luhufsky to show how institutions have responded to the tumult over the past year and how SMFM members have worked within their institutions to provide access to care. Alicia.
Thank you so much, Chloe, and good morning, everyone. I'm Alicia Luhufsky. I'm SMFM's lead strategist for reproductive health and access, and I'm so pleased to join you today to look back and look ahead and reflect on how the medical community and healthcare institutions have responded in this year since Dobbs. So immediately after the decision, SMFM brought maternal health specialists together in a statement denouncing the decision and continues to work collaboratively with these organizations to oppose harmful policies. And as states began to propose and implement restrictions on care after the decision, the healthcare community continued to coalesce in shared dismay and concern about the court's action and its expected impact on access to care and health outcomes. In July last year, over 70 healthcare organizations, including SMFM, joined ACOG and the AMA in joint opposition to legislative interference in medical care. Next slide. And however, despite this unified front from national medical organizations, we know from the stories that we've heard from you that the local response has been varied. So we're curious about what your experience has been. If you practice in a hospital setting or a practice, how supportive has your institution been? Have you felt like you've received the information you need or the support you need to continue providing care? So we'll give it a second to get some responses here. And I have to say the responses we've received have been all over the map. Great. So we have some shining stars and certainly some that could do better. So next slide. So I think your responses reflect the range of experiences that, again, we've heard from our members. Some institutions have limited not just the care that our members can provide through institutional policies that unfortunately sometimes go even beyond existing law, but have also limited clinicians' ability to speak about their experiences. particularly in the most hostile states. As a result, SMFM has been gathering member stories, which can be submitted anonymously, and we'll put that link in the chat. Successful advocacy in state legislatures, Congress, and with the media relies on our ability to describe patient care experiences and how policy impacts access to care and health outcomes. So we hope you'll contribute to the stories that we've been collecting. Other issues at the institutional level, of course, include concerns about clinician training and workforce issues. And we're following closely the administration's actions on EMTALA, the Emergency Medical Treatment and Labor Act, and we'll drop in the chat a link to a section of the SMFM website that's now devoted to EMTALA issues to keep you informed. Next slide. The SMFM Reproductive Health Advisory Group members, Justin Lappin and Layla Zahedi-Spung, recently shared their own experiences with institutional responses post-Dobbs in this New England Journal of Medicine commentary written collaboratively with a complex family planning subspecialist, Ashley Brandt. The authors described two extremes of institutional response as Doctors Lappin and Brandt experienced hospital systems in Ohio that mitigated confusion and maximized access to legal care by working collaboratively to interpret and address post-Dobbs abortion restrictions. Unfortunately, at the other extreme, Dr. Zahedi-Spung describes a less supportive institutional response that led to an environment of chaos and confusion with resulting interstate transfer of patients and a sense of legal vulnerability and moral distress among physicians. Next slide. To help SMFM members navigate varied institutional approaches, I want to remind you of a document we released last summer, Clinical Considerations for Management of Severe Complications When Abortion Care is Restricted, a document providing a summary and links to relevant SMFM clinical guidance and recommendations for approaches to working within your institutions to optimize access to care in restrictive settings. In addition, SMFM, in partnership with the Society of Family Planning, offered a webinar session earlier this year focused on building statewide, regional, and institutional coalitions to address abortion restrictions and improve patient access to care. This webinar, available on demand on the SMFM website, includes presentations from pairs of MFMs and complex family planning subspecialists from 2 states. One, a supportive state that has convened multidisciplinary coalitions building referral networks and other supportive structures, including centralized care coordination for patients needing complex hospital-based abortion care. And the other, a more hostile environment where hospital systems across the state convened to build a consistent approach to restrictions. Next slide. One of the key takeaways from that webinar was the importance of seeking legal and regulatory advice when needed from those with experience in reproductive health and rights cases and expertise not often found in hospital counsel offices. To assist in those efforts, we want to share with you this link to the Abortion Defense Network. This coalition of legal organizations and trained private law firms and attorneys are committed to providing free legal resources for any abortion provider, including SMFM members. The Abortion Defense Network can help with legal representation, answer legal questions such as, what do the recent mifepristone court cases mean to my practice? Or how do I interpret changing laws and regulations and the exceptions in those laws? Provide assistance to you when preparing for discussions with your institutional legal counsel, and more. In addition, the group has established a legal defense fund to cover legal defense costs for those experiencing criminal or civil liability related to providing regulated abortion care. And this includes representation to medical boards and in the courts. We encourage you to submit a request through the Abortion Defense Network website for any needed legal assistance. An attorney will review your request within 24 hours. SMFM staff are also happy to talk with you at any time about any needed legal assistance, as we have also connected with several law firms interested in providing pro bono support to providers. SMFM staff are also happy to provide any other assistance as you work within your institutions to improve access to care. And with that, I'll pass it back to Samantha.
Thank you, Alicia. So now that we've reflected on policy changes and how institutions have responded to Dobbs, I'd like to turn our attention to the amazing advocacy that we've seen from providers and the medical community at large. In the last year, SMFM and our members have taken action in over half of states, and I'm fairly certain that there are folks in these gray states on your screen who are also actively advocating for abortion and just haven't told us. But this map includes the 21 amicus briefs SMFM joined in 15 states in the last 12 months, along with several briefs in federal court cases, as well as the letters of support or opposition we have sent to state legislatures at the request of our members who are helping us monitor movements in their states. You and your colleagues have also dedicated a significant amount of time to publicly and privately advocating for abortion access in your states, as well as at the federal level. It's no surprise that journalists have turned to providers to learn about the impact of Dobbs on your work and your patients. Across the country, stories featuring clinicians, as well as clinician-penned op-eds, outline the harms resulting from these restrictions, introducing readers to the patients you have been forced to turn away. Clinicians have also been front and center at rallies, speaking to large crowds against proposed restrictions, sharing testimonies at legislative hearings, and serving as expert witnesses in the courts. And on your screen, you'll see pictures of just a few of your colleagues who have been front and center in the fight in their states. We've also seen providers across specialties and licenses come together to protect access to abortion care. Several states, including Michigan, Missouri, and Montana, organized sign-on letters to fight restrictions and advocate for expanded access. Folks have also created formal coalitions to establish an infrastructure of advocates to respond to ongoing threats to reproductive health. For example, Good Trouble is a coalition of clinicians in Indiana that was established last year to organize advocacy efforts by healthcare professionals. They organize around reproductive rights, along with other public health issues like the COVID-19 pandemic. Campaign for a Healthy Nebraska was established by local female physicians last year, and they aim to provide and protect access to all aspects of reproductive health care. And finally, Ohio Physicians for Reproductive Rights is a coalition of physicians working to codify access to reproductive health care, and they are at the forefront of the ballot measure in Ohio. So I'd like to hear from you all. How have you and your colleagues been advocating for abortion access since the Dobbs decision? This can be anything from attending a rally, speaking to your colleagues, even, posting on social media about your work. We'd love to hear from you.
Well, I'll start. I'm Washington Hill. I'm I guess by now senior maternal-fetal medicine specialist here in the state of Florida. When I came to the last meeting and I would go up and introduce myself, someone would say, "Oh, you're from Florida." Well, I think what we've been trying to do here is to certainly clarify what is going on, because as I've seen from some of the information sent into ACOG, there's a lot of confusion. And I appreciated Chloe's summary. We have a 16-week ban. It currently is working its way through the Supreme Court of Florida. We have no idea when that decision, of course, is going to come down. That court is very conservative. Our governor, as you know, is Governor DeSantis. So we really don't expect a favorable decision. And if it's not favorable, then the 6-week ban will go into effect. So that's the lay of the land politically as best I can understand it. In terms of our hospitals, I think most of the hospitals have worked closely with their hospital attorneys. We certainly have done that, who have tried to interpret where we are and where we're going. In terms of clinical practice, it certainly has affected it. A patient with ruptured membranes at 20 weeks in the olden days, we would just be able to talk with her and abide by her decisions. But now we have to talk to her about the law, look at her clinical status, and this becomes somewhat confusing. And lastly, we work well. I worked well with Planned Parenthood for years, and certainly they have resources to help patients who need to terminate their pregnancy for whatever reason. So it is confusing, and certainly we now have to jump through some hoops that we didn't have to before. As you went over the material, I did not know about the legal network. And that brought to my mind that we need to continue to work hard on getting this type of information out to our colleagues. And thanks for putting this on.
Thank you, Dr. Hill, for sharing. I think you brought up a few good points in that. Advocacy is very broad and looks very different depending on where you are and what's needed. So from working with, as you said, hospital legal teams, trying to help people within the confusion of all the laws, advocacy is, it looks different, and it's okay to, not be doing everything, but to be doing your best and getting people the care they need. So thank you for what you're doing in Florida.
My pleasure.
And I would, sorry.
Go ahead.
Sorry, Dr. Zahadian, in Colorado now, but I was in Tennessee, and I just wanted to say, Dr. Hill, and to anybody else who's in a restrictive state, you are doing the most by taking care of people in those places. So thank you for whatever it is that you're doing, because what you're doing is impossible and is really hard. And all of that advocacy you do on the ground, taking care of patients, is the most important thing we do on a regular basis. So in case anyone hasn't told you that, even if we do cringe when you say you're from Florida, we do understand that you're working really hard. And especially as someone who came from Tennessee, I feel your pain. But we are also happy to take care of your patients whenever you need us to.
Thank you. I think it's also important that, and I've written about this and sent something into ACOG again, it's important that we make sure that our patients are getting accurate information. And I know that we're doing that and trying, whether it's correcting misinformation or just answering questions or directing patients to where they can get good information. Because if we don't do that, I graduated from medical school in 1965. You can do the math, but it was before Roe versus Wade. And bad things happen. So we need to make sure that everyone who needs it gets accurate information, gets information about resources, and there are plenty of resources, including financial resources. I just preach that all the time. Thank you.
Thank you both so much for your comments. And, really, I think it's so important that providers are in this fight for so many reasons, but just like what you said, you have the ability to build trust with patients and the expertise to dispel the narratives from anti-abortion folks. So really, it's so wonderful to have you all doing this work. And, it's very much appreciated from patients and folks alike. So with that, Just again, thank you all for sharing what you've been doing in the last year. I think now is a good time to look ahead at the challenges and opportunities that are ahead of us. Fortunately or unfortunately, depending on how you look at it, most state legislatures are no longer in session. So 11 states are still in regular session and 3 are in special session, meaning that many of us have a chance to catch our breath and plan ahead instead of just reacting and playing defense in the policy space. And this is, of course, important because we know we're not going to get full access to abortion overnight. It's going to be a long road ahead. That said, since there is a lot we can expect in the next several months and years, I'd like to spend some time talking about what we could see in legislatures, in courts, and in ballot measures. So as we've seen over the past year and even beyond, anti-abortion legislators have gotten very creative in their attempts to ban and restrict abortion access. And we can unfortunately expect this nonsense to continue. Antis have long been trying to pass fetal personhood laws in states, which are laws that essentially say an embryo or a fetus is a person and thus has equal rights as you and me. Along with the obvious consequences for abortion access, this will have a rippling effect impacting access to contraception, fertility treatments, cancer treatments, and so much more. In some states, lawmakers are setting the stage for personhood laws by proposing bills that rely on propaganda and misinformation, like Born Alive bills and partial birth abortion bans. So as we've said, it's critical that we speak out against these narratives and keep pushing forward accurate information for patients. Now, in states that have tried and failed to pass total or near total bans, we can expect to see what lawmakers may call common sense bans. And of course, we know that no ban has any common sense to it at all. These will likely have later gestational limits and or include more exceptions to appease those against more restrictive bans. They may also include additional barriers like longer waiting periods and extensive reporting requirements. So one example that we've seen this year, Nebraska failed to pass a 6-week ban and later introduced and passed a 12-week ban. So again, none of these bans are common sense, so it'll still be important to counter narratives, especially from anti-abortion legislators who are claiming that they're trying to compromise. Something else we're likely to see more of are gut and amend bills. So these are bills that have already been introduced and sometimes even gone through committees that are then stripped of their original language and or amended to include language on a totally different subject. This is how North Carolina was able to introduce and pass their 12-week ban so quickly and why it was really hard for advocates to respond in a timely manner. It's thus important to try and build relationships with state legislators so that you can have a slightly better sense of what may be coming. Although with gut and amend bills, it's really hard to see these coming down the pike unless you are really glued into the legislative process and have connections with folks on both sides of the aisle. On the positive end, we can expect additional shield laws and protections for providers as well as patients. While existing shield laws have not been fully tested, they have eased anxieties and even allowed online medication abortion sellers like Aid Access to ship pills from the US rather than abroad. Finally, we can expect more bills in protective states on data privacy, both in terms of regulating tech companies that store data and how electronic health records communicate between states. I didn't include on this list, but I think it's worth mentioning the potential for movement on the federal level. So we know that several members of Congress have mentioned supporting a national ban. And so while that wouldn't pass the chambers today, we know elections are coming up in just over a year. Hopefully, more pro-choice and pro-abortion members of Congress are elected, and instead of a ban, we can pass legislation like the Women's Health Protection Act or WIPA, as well as repeal the Hyde Amendment. On the court side, we are still waiting for resolution on the mifepristone cases that are in federal courts. With multiple cases being heard, this will be a long, ongoing battle, and you can follow along with us at smfm.org/MIFI. We'll also continue to see cases challenging bans in state courts. This includes ongoing litigation, as well as litigation that will arise when new bans are inevitably enacted in the future. With existing bans in place, more time passing since their enactment, we may also see more lawsuits from patients and providers when, unfortunately, patients are unable to receive the care they need, or providers are criminalized or targeted by state officials. In a similar vein, as more states pass bounty laws, there will be cases against providers and, quote, aiders and abettors, as well as countersuits. So there's an example out of Texas where a husband sued his wife's friends for helping her obtain abortion care, but they later countersued him because he apparently already knew she was going to get the abortion and was using it after she completed the abortion to blackmail her into staying with him. So in any case, in the future, these cases will also test the shield laws that have been enacted for patients who receive care out of state and the providers that support them. Following the success of the 2022 ballot measures, we can expect to see a number of additional states using this method to shore up protections. Of course, there will also be states attempting to use ballot measures to remove constitutional protections for abortion, including those recently added by successful initiatives. New York and Maryland passed laws this year that will put abortion on the ballot in 2024, and currently organizers in Ohio are counting signatures in the hopes that they meet the threshold for their measure to be on the November 2023 ballot. However, as Dr. Zara mentioned earlier, the success of ballot measures means that antis will likely attempt to block or limit this process, whether by changing vote or signature thresholds, removing citizen-led initiatives as an option, or just making the entire process more labor and time-intensive. Now, as we've said earlier, the road to unfettered access to abortion is going to be long, and it's not going to happen overnight. So the two big questions are, how do we stay motivated and engaged in our advocacy, and how do we prevent burnout? I'm sure you've all received countless advice on how to do so, but I'd like to focus on three that I like to practice for myself. And they are building community, prioritizing rest, and making time for joy. So it may be obvious that more people can increase the amount of advocacy you can accomplish, but building community is more than just increasing your numbers. It's about building and investing in a system of trust, support, and sustainability, which requires intentionality and even a level of vulnerability. The work that goes into building community may seem like time and effort that you can spend on more direct actions, but I promise you it's critical to maintain your own motivation and to prevent burnout. It's also very likely that there are already communities you can become a part of. So I recommend that you start talking to your colleagues, your neighbors, reach out to grassroots organizations like Dr. Hill working with Planned Parenthood, find the people who are also working to make change and build those relationships. It's not only going to increase your numbers, but more importantly, provide a space for you to unload the mental and emotional weight that you carry by doing this work in silos. So I'd love to hear from you all what communities you're a part of and how do you show up for your communities. And you're welcome to use the poll or unmute yourself and share with the group.
I'll unmute myself just since I'm already on camera. SMFM, that's right. I agree. This community has been really amazing. And for anybody who's not otherwise connected, please feel free to reach out because there's so much going on. I think we've really united. I've had people in multiple other areas of OBGYN comment to me about how impressed they are with SMFM. So I'm really proud of the society and how we've come together. Also just say like community locally, my people in my town, we have this, where I live, we have a fairly convoluted governance structure that involves like a town House of Representatives, basically, but people were super excited to learn what they could do and have really engaged providers in our town, which is really interesting.
Where do you live, if you don't mind saying?
Yeah, I live just outside of Boston in Brookline, Massachusetts. So, you know, one would think we're sort of a suburb with not much to contribute, but lots of doctors living here. And so lots of folks who are interested in trying to make sure that there are provider protections. And it's led to conversations about expanding contraception at the high school, all sorts of exciting stuff.
I'm happy to share. So I'm Erica Werner. I'm chair at Tufts in Boston also, although I live in Rhode Island, and I'm the chair of HPAC, which has been a pleasure. I think in terms of communities that I'm part of, I would echo what Chloe said. I think SMFM has been sort of one of the few bright spots in a otherwise fairly bleak, I'd say more, 2 years, because I was with SMFM before the Dobbs decision came out, when you all organized a rally that we participated, or when there was a rally that was organized and you all helped us to get there, which was great. I think SMFM has done a really great job for those of us in permissive states, helping to connect us with those who aren't as lucky, and allowing us, I think one of the ways I felt powerless was that as listen, I feel for all of my colleagues in Texas and Florida and Montana, and you feel like there's not that much you can do, but you've given us a voice. And so my institution, thankfully, lets me speak freely with all of my credentials. And so I've been able to tell some of the stories from my other SMFM friends and colleagues, and that's given me a way to feel part of this community. I would echo, I really enjoyed Washington Hill's comments, and I would echo that I love that we have this, group of lawyers that are willing to help people in restrictive states. I do think that for the first time, my friends from all across the country who are not physicians have sort of, are reaching out to all of us to get what they can do. And that's been, so I would say my community is also all of my non-medical friends who are asking how they can help and looking for ways and avenues to do that. So thank you.
Thank you both for sharing. And I promise this question was not a setup for everyone to say SMFM, but we are nevertheless grateful that you are all a part of this community.
I would add to that, when Planned Parenthood or another organization has a banquet or a dinner or asks for donations, even if you can't go, or if you can go, it's important to show up to that event, so that the community will know. And you'll be surprised, as was mentioned, how many of your other colleagues in the community who are not physicians, non-physicians, are there and appreciate you being there. So I would say to show up to those type of events, so your presence shows support. And every now and then they have a board opening, and I'm sure more than one of you have been approached, would you like to sit on the board? But certainly then hitting the donate button is helpful.
Thank you, and agreed. Having events to go to in this space that are about celebrating our work versus just, yelling about how horrible restrictions are, even though that's important, it's also important to be celebratory and be among folks who share your values.
Thank you.
So the second, and again, probably obvious key to maintaining motivation while preventing burnout is to prioritize rest. And I don't just mean the occasional break where you're working really hard for 3 months and then take, a long weekend vacation and then come back and say you need another vacation from your vacation. I mean, regular, intentional rest. There's no way you can speak at every hearing, talk to every reporter, and also keep your jobs that are already time intensive and maintain a personal life. That's just not possible. It's better to be realistic with how much time you can dedicate for your advocacy and make sure you're allowing yourself regularly to take a break, not just from the advocacy work, but from the news and just how emotionally exhausting it all can be. And when you start feeling pulled in a million directions, it's okay to take a step back. You're more effective when you're rested and have a full tank than when you're running on empty. And this is really crucial. It's really helpful when you've built your communities, because then there will be people to step in during your absence and really give you the time you need to refresh. So I have another question for you all. Again, you can use the poll or unmute. I want to know what rest looks like to you. It could be going for a walk, listening to a podcast, meditating. Maybe we don't rest enough.
I don't think we do. This is hard work, whether it's this work or DEI work. This is hard work. It doesn't come quickly, and it's tiring. I think all of you would agree. It is tiring. We get up in the morning and we say, what can I do? And you have your list, but it's tiring, it's hard work. And we have to find a way to rest, whether it's going here in Florida to watch the sunrise and walking around with the mosquitoes, or sunset, or going to the beach, or some moments with your partner, or seeing a beautiful osprey as I did outside this morning. We have to do those things, because if we're not well, then we can't do the work that we have chosen to do. And each of us will do it different. Those of you in Boston do it different than we do it in Florida. But we have to find a way to rest. This weekend, I'm going to go out to Laramie, Wyoming, wherever that is, and meet with a mentee and her family who I've known. And that to me is rest. I'll be a cowboy. Black cowboy. But anyway.
Please send us photos.
Yeah, I will. I'm sure Jessica will take some. But you all get, and I got up, we all get up in the morning and say, someone's chair of the department. It's tiring, but you have to find time. And you're right, we're not talking about a long weekend after working hard 3 months, and then you come 3 months and you go, boy, oh boy, I'm ready for another vacation. Well, you didn't rest. But we have to take care of ourselves, and I tell young people that. And you all are all young people to me.
Thank you. Could not agree more. Resting is so important in this work. You're not going to get everything done without making sure you are okay. So I think the last tip I have to maintain your motivation and prevent burnout is to make time for joy. And I want to clarify, this is different from resting. Resting allows you to catch your breath, while joy should help energize you and keep your spirits up. We know this work is serious, it's heavy, and it's easy to fall into a cycle of despair and cynicism, which leads to burnout more quickly and just makes you associate advocacy with despair. That's why it's so crucial to carve out time and experiences for joy. Whether it's the thrill of a roller coaster, playing dress up with your kids or your grandkids, or reading a trashy magazine, joy is absolutely necessary to sustaining this work and to keeping yourself healthy. So if you haven't guessed already, I'm asking you how you make time for joy and what joy looks like to you. Again, feel free to unmute, or you can use our poll feature. And while folks are filling that out, I'll just share wrestling with my dog is like so joyful and very easy to do. I see folks like to travel. Absolutely. Wonderful. Thank you all for sharing. With that, I want to thank everyone for joining us. We're not over yet. I'm going to stop the recording, stop sharing my screen, and let us have the last 5 or so minutes to ask questions and use this space to commiserate or to share what we've been up to.